Hello, I'm Tina Connor. I'd like to introduce you to the Epocrates application. Epocrates provides clinicians confidence in decision making and saves valuable time in making information easily accessible. This presentation will concentrate on the application, which is free to download on a mobile device or view on their website. There is an option to upgrade to Epocrates Plus for a fee, which offers additional resources to the clinician. Epocrates was created in 1998. Since then, more than 1 million clinicians have downloaded the application. Epocrates has collaborated with many industry leaders to provide up-to-date and relevant information for clinicians to utilize in the field. Epocrates has a medical information team, which includes GoodRx, a resource for medication costs, Managed Markets Insight and Technology, which provides information on drug formularies and prior authorizations. The producers of British Medical Journal offer an easy-to-use reference for diseases as well as many more. The Epocrates application has several features which can be very useful in nursing practice. The top left of the screenshot on the left is the drugs icon. Clicking this will bring the user to a list of drug classes as pictured in the screenshot on the right. A drug class can be selected to view the many medications that may be prescribed. Nurses can also search a specific drug using the search box. This can be particularly helpful in learning about an unfamiliar drug as well as teaching the patient what it is prescribed for, dosing, contraindications, and interactions, just to name a few. The interaction check allows the clinician to input any number of medications and will indicate if there is a potential for harm to the patient, as well as recommendations for avoiding issues. Pill ID allows the user to input a description of a pill by entering imprint, shape, color, score, coding, and clarity to discover what medications a patient is taking without having the bottle. For example, a patient has had a medication change and brings you their filled pill box. Pill ID will help you identify their medications and make adjustments as needed. These are just 3 of the many features included in the application. Others a nurse may find useful are the COVID-19 resources, calculators, and journal articles, which are seen at the bottom of the screenshot on the left. These can also be found by clicking notifications or by typing a subject into the search box at the top. The user can choose to use the basic operations of the app or upgrade, enhancing the utility with several more features that are offered. The Epocrates platform is recommended for healthcare professionals, so it may be a little advanced for the lay person. The content can be accessed through the website or on any smart device via the application. It is a very user-friendly and easily navigated app. The home screen, as pictured on the left, is the main screen of icons, which are possibly most used by clinicians. Swiping left or right will show you more options. When in doubt, the Search Epocrates box at the top of the screen will give the user the option to input what they are looking for. To return to the main menu, simply click the house icon located at the top of any screen. All icons within the app are labeled with clear and concise descriptors. The application saves recent searches in the event there is a need to go back to that item quickly. Each click will give you more in-depth information. Starting a search with hypoglycemia, for example, will bring the user to a screen which lists drugs used in non-diabetic hypoglycemia, drugs with related adverse reactions, conditions that mention hypoglycemia, drug subclasses, herbs and supplements for hypoglycemia, ICD-10 codes associated with hypoglycemia, and a formulary button with preloaded formularies that are common in your area based on the practice zip code provided at registration. You also have the option to add formularies of your choice, which is also a simple process. The standard Epocrates application is free of cost and is a very valuable tool. The enhanced version, called Epocrates Plus, has added features which would benefit users that require support with disease information, infectious disease treatment, alternative medications and interactions, as well as labs and diagnostic information. The Plus version seems more geared for those practicing above the level of a registered nurse and may be quite useful in their practice. There is a free trial of the Plus version available. I would strongly encourage those interested to check it out. The application does have a privacy policy and will share information only with the user's consent. If there is a need to update, correct, or delete any of the information that was provided or opt out of promotional emails, sending a simple email to the support team will do. Epocrates stands by all information available on any of its forums as the presented material is provided by professionals in the field. The benefits of this application are that it is extremely user-friendly, easy to locate information, and can go more in depth if the user chooses to do so. It is highly concentrated in pharmacology to assist in preventing medication errors and interactions, which is, for the most part, the basis of most treatments. The option to upgrade is a nice feature. The limitations of this app are that the add-on features can be a bit pricey if the user intends to utilize it for more than pharmacology. Overall, I would say I would highly recommend this application as the information it offers in the free app alone is quite valuable. As a nurse, it is not only an opportunity to provide safe patient care, but also a tool to further educate our patients. In conclusion, the Epocrates application would be a great addition to nursing practice. It is easy to use and provides an abundance of education on medications and what we need to educate our patient about taking them. This is a great tool to help provide safe, efficient nursing care.